Hi, my name is Marella Deischer, and I'm privileged to have been asked to speak at the first annual Surgery and Therapy Summit. I'll be discussing clinical exam of the wrist, and we'll start with a thorough review of the anatomy and then go into differential tissue assessment. We'll also demonstrate that and then discuss a number of provocative tests about the wrist. Most importantly, we're going to help you organize your exam so that it's systematic and thorough, and so that you're obtaining the needed information to help best inform your treatment plan for your patient. So I hope you'll be joining us. I'm really looking forward to this, and I hope you are too. Thanks for listening.
Hi, my name is Jamie Bergner. I'm an occupational therapist, a certified hand therapist, and a certified orthopedic manual therapist. I'm a full-time clinician at Vanderbilt University Medical Center in Nashville, Tennessee. I also teach live continuing education courses through the International Academy of Orthopedic Medicine, US Hand and Upper Extremity Track. I'm adjunct professor for Cox College in Springfield, Missouri, and I also have continuing education courses through MedBridge. So welcome. I'm really excited to talk to you today about my course that I'm going to teach for this conference. So we are going to talk about the dynamic scapholunate interosseous ligament rehabilitation, a therapist management of pre-dynamic dorsal intercalated segmental instability. So really exciting topic to talk about with some really great research. So there's a few things that you're going to learn from this talk. First, how to analyze those patients that come in with a diagnosis of wrist pain, very unspecified, not sure where to go about treating them. We're going to cut to the chase and figuring out which of those patients might be a pre-dynamic dorsal intercalated segmental instability. Next, we're going to take that information that we've learned and learn about the arthrokinematics of the wrist, those dynamic movements that occur between those carpal bones, and how important it's going to be to bring that scaphoid into extension next to the lunate for that dorsal coaptation that is required for that SL ligament to heal. Next, we're going to take a look at our manual therapy approach of the radial column and how important it is for the mid-carpal joint to move. That's the function of our dart thrower's motion. By working in dart thrower's motion, we're going to offload that SL ligament. But if it can't move because it's stiffened up to splint or support the SL ligament, then we can't recruit that plane of motion. So I'm going to show you some techniques that'll help with that. Next, we're going to look at the function of the ligament, that recruitment system to support that neuromuscular control and offload the SL ligament when it's in trouble functionally. So we'll take a look at those SL-friendly muscles and how to recruit and utilize those in our rehab, and how to inhibit those SL-unfriendly muscles. And I'll give you a clue. It's on the ulnar side of the wrist. Okay, so once we look at the system and working that system, next we're going to have some fun. We're going to move into the dynamic rehab program, where we look at how we can get that fast, efficient recruitment and with some fun activities in the clinic. So we'll take a look at that and design that comprehensive rehab program that will really help your patients get better quicker. And we'll also educate and partner with our clients to make sure that they know their risk for progressive instability down the road, so that we can modify those activities and really make sure they can engage in the things they love to do in a very wrist healthy way. So I'm really excited to see you and talk to you soon. Have a great day.
Hi, welcome to Assessment and Management of Forearm Stiffness. My name is Ann Pareto-Lurkey, and I want to welcome you to today's lecture, where we're going to discuss the systematic approach to helping problem solve those patients that come in and you ask them to bring their palm up, and then they slowly start to tip over because of the limitation. We're going to be going through how to evaluate and treat issues at the distal radial ulnar joint, where we find more issues with malalignment, and proximal radial ulnar joint, where we have stiffness limitations. So going through that step by step will be so helpful for you in the clinic when you get your next patient that can't bring their palm up or down. Thank you.
Hi, good afternoon. My name is Shrikant Chinchalkar. I'm a certified hand therapist and recently retired occupational therapist from Roth McFarlane Hand and Upper Limb Center. I have been involved in treating upper limb injuries for a number of years. This is truly a 51st year of my clinical practice. I am going to present on elbow trauma elbow anatomy, and then going to focus on, my presentation will be focusing on elbow anatomy, elbow mechanics, and then going into some specific disorders such as terrible triad and how to manage these conditions clinically. So please join me for the elbow session, and I'll be delighted to have your participation during the summit as well. Thank you very much.
Hi, welcome to Identifying Potential Shoulder Issues in Your Hand Therapy Patient. My name is Ann Pareto-Lurkey, and what I'd like to talk about in this upcoming lecture is going to be helpful for therapists, especially those that maybe aren't as comfortable with treating the shoulder, going through the history and some basic clinical tests that you can do for 3 specific things that address shoulder problems. The first being adhesive capsulitis or frozen shoulder. How to identify in our patient's history that they're developing a frozen shoulder, what are some clinical tests we can use, and what are some things that we can use in the hand clinic to help get them started and know that when we need to refer or if we can continue and their problems will resolve with just some of our interventions. Our second piece is going to be covering thoracic outlet syndrome, and that's probably one of the most poorly understood diagnoses in hand and upper extremity rehab. We're going to talk about the 2 different types, go through some clinical testing, and then some basic things again that you can do in the hand therapy clinic to help facilitate improved blood flow to the brachial plexus downstream. Our third piece is going to cover shoulder impingement with an emphasis on external impingement, those patients that present with a painful arc. We're also going to be going through listing for our history and doing some clinical tests to help evaluate if someone has a rotator cuff tear. All of these things are going to be helpful. We spend time with our patients so frequently throughout the clinic that we can listen for these cues and know if someone's developing something more proximally, we'll know what to do. Thank you.